All right. My time here is in Toronto, 3 p.m. So I think we should start. And as people join in, they will hopefully catch some of the presentation. First of all, I would like to say that it's great to be with all of you here today, even though it is virtual. And honestly, we are so tired of the virtual, especially as students. I understand you all very well. Even in our working life, we are all virtual as well now with our meetings and this, and we're missing that human contact. But I hope the most important thing is that everybody stays safe. I hope that all of you and your families are well and staying safe. I'd like to introduce myself first. My name is Dr. Dinsel. I am the registrar of All Saints University School of Medicine, Dominica. Uh, Together, we're joined with my admissions officer, Miss Deanna Gallant.
Hi
We
everyone.
are, yeah, we are with you from our Toronto administrative offices near Steeles and Weston. For those who are in Toronto, will know our areas a little bit. All right, so we're here and we've been allotted a little bit of time to tell you about All Saints University School of Medicine, Dominica. So what I'm going to do first, just to give an overview and to be visually stimulating a little bit, I am going to have a very short presentation. All right, so everybody can see the screen, yes? All right, uh, Deanna.
Yes.
Okay, so we can see the screen, yes?
Yep, we're all good.
All right, fantastic. Okay, so here we go. All right, so again, we're here to tell you a little bit about All Saints University School of Medicine, Dominica. I've heard that there are many students here that are thinking to plan their future careers. If you are considering medicine at all, we are a great option for you that way. What is our mission? Of course, our mission is to educate, compassionate, well-knowledge medical professionals. But I really believe that our main mission is to give students the opportunity to study medicine, which is the most important thing. As you know, in North America, a lot of time, students that are keen to become medical doctors in the future, they do a lot of voluntary work at hospitals all through high school. They go to university, they do an undergraduate degree, they then, get the 4.0 GPAs, this and that. But the competition is so fierce here that it's like that in Canada and the US, that only less than 10% of students that actually apply to medical school will get in North America. So what about all the other students that have that passion to study medicine? Well, then we are the perfect option for that. So it is all the opportunity that we can provide. We are a school that has been open since 2006. We are a Canadian-owned medical school, and we are registered um, under the World Directory of Medical Schools. We have a FAMIR number. We're accredited by the ACCM. I go on and on because over the years, we've been recognized. We have students and graduates all over the world. These are very simple sites here that are open to the public, very accessible. So you can yourselves go on to these just to look into the school and its credentials. Also, if you visit our website, allsaintsuniversity.org, we have links to all of these things as well. To do your research, it is a good thing. The advantages of All Saints, what is it? Well, we do have small class sizes, which is very important. Our staff, the professors on our basic sciences campus, they are with us for a very long time. They're very qualified. Some professors have been with us since the beginning in 2006. We do have agreements with the provincial aid programs in Canada. So the Canadian students can apply for, be it OSAP or Alberta aid, Saskatchewan aid, BC aid, whichever province they should be living in if they are Canadian that way. All right, so I wanted to just jump into how the program works and where students can enter into the program. The MD degree program, the total of it is a 5-year program. Now, 5 years sounds like an off number, but it's a little bit condensed that way because there's not a lot of summer vacation happening. It's just one semester and there's only about a week and a half between semesters. So it goes by a little quickly. The 5-year program, to enter that, you have to be a high school graduate. So we have had in the past Canadians and Americans that realize, maybe I don't want to do a bachelor's and decide exactly what I want. I'm very passionate. I'm very keen. I've always wanted to study medicine. If that's you, then, it would be a great idea. You can, right after high school, apply to our 5-year program, which has 4 semesters of pre-medical sciences. I'm going to get to that a little bit later. So you can start directly in the medical program that way. If a student has a bachelor's degree, they've done sciences, say, in any discipline of science, then they automatically are exempt from that first pre-medical year, and they can apply directly to the 4-year MD degree program. In Canada and the US, all medical schools are 4-year. You would have to have a minimum of 2 years of sciences, university science courses to actually apply to a medical school here. The same goes with us, for the 4-year program. However, of course, because the competition is so fierce, it is very unrealistic to apply to any medical school here in Canada or the US without actually finishing a 4-year degree. So those are the 2 points of entry into the program. If we have a look at the breakdown, as I was saying, the first year is the pre-medical program. So it's made up of 4 semesters, semester 1, 2, 3, 4. And then the student just progresses on into the basic medical science. And that is where MD1, if you will see in the second column, is where the 4-year program starts. When we look at all of this, of course, it's good to know location, because this university is not located in Canada, although it's Canadian owned. Our basic medical sciences campus itself is located in the Commonwealth of Dominica. And so the students that join for the 5-year or the 4-year, they will spend 1 year, they will spend either 2 years, depending if they're in the 4-year, or 3 years of their basic medical sciences until they finish in the on campus in the Commonwealth of Dominica. Once that is finished, our students, the last 2 years, go on to do their clinical clerkships. Clinical clerkships are made up of 72 weeks of rotations. These 72 weeks of rotations are divided into 2 groups. One are core rotations, which are the first 48 weeks, and then elective rotations, which are the remaining 24 weeks. Those clerkships can be, I will get to that later as to the location, but they are mostly in the United States, the hospitals we're affiliated with, and Canada for the Canadians that want to come back to do elective rotations. here as well. Again, this is a very short breakdown of the 4-year program. And just to give a little idea of the kinds of courses that are taken each semester in the year 1 and 2 of the 4-year program. That way, we have added to this, of course, we have patient-doctor relations. There's a few different courses that have been added, but the main bulk is this. Of course, being an accredited school, what does that really mean? Being an accredited school, an ACCM accredited school, means that an external North American recognized board or body has come to your school, evaluated it, and found the educational standard, the education, to be equivalent to medical schools in North America, the US or Canada. That's all really what accreditation means. It just shows the standard of education in a program. So this is a breakdown. I wanted to add this slide because I know a lot of students, especially when my daughter, she just finished a university in Toronto. And before she actually applied to university, she was going through all and doing her research in all the different universities available in Canada for her. And it's while doing that research, I think this is a very important factor, is the tuition fees. We have always prided ourselves to keep our tuition fees as low as possible. And the reason, and as comparing it to other medical schools, private ones, you will see the difference anyway. We pride ourselves in that because the goal here is not so much profit run, but it is the vision of the company and the owners, and to allow students to realize their dreams. And that is the most important thing for us. So it's just a breakdown like this of the different semesters to give you an idea. Again, our campus is located in the Commonwealth of Dominica. People always get it mixed up with the Dominican Republic. It's not the Dominican Republic. The Commonwealth of Dominica is a beautiful island in the Caribbean, and it is a rainforest island. It has rainforesty things, very low tourism, overnight tourism. Usually there, the boats will come in, the big boats, and during the day, they'll let out tourists, but the tourists are gone by 3-4 p.m. because the boats then will leave the tourist boats. So it's very quiet. It's a perfect place to study. In fact, I have students sometimes being bored in the evenings because there is not much to do but study, as the island is left to the nationals there after hours. Our campus, now, I have some pictures here, and I must say they do not do justice. Our campus is located right in the middle of Rousseau, which is a city in the Commonwealth of Dominica, and it is right in the city. In other words, right across the street from this is the huge marketplace. It's a 10-minute walk, not even 10-minute walk to the port, where boats can come and go. So students have very easy access to everything. It's not a campus that's outside, where you have to bus it to get to school and back. So it's all walking distance, and it's a small city anyway. So those are a few pictures like that. I think the most important thing is this. In the Commonwealth of Dominica, in that country, we are the only medical school. That being the case, our students are viewed a little with pride, I think, amongst all of the nationals in Dominica, because our students are active while in the basic medical sciences phase. As I said, again, I remind that this is just basic sciences campus. So while they're there, our students will have health fairs in the population, in the island. They will do, for example, like a week of diabetes awareness, and be out there in tents. Or they'll do hypertension and cardiovascular disease and things like that. So it's a fantastic opportunity for the students, one, great reference, great opportunity. And it's great for the nationals because they then get to, really associate with our students and things like that. So it's great fun, even though it is a little bit of time that you're there, but it is great fun. It's a great opportunity and it's fantastic weather all the time. Canadians, you know what I'm talking about. In the winter time, it's great to be there for sure, that way. Now, when it comes to the clinical clerkships, after the basic sciences are finished, we do expect all students, it's a requirement to take the USMLE Step 1 examination, which may be a little bit more, too much detail. But what USMLE is the American board exam, part of one of them. And all students in the US will take it at the end of their basic sciences. The reason why is that our students will then go to the US. Now, we are affiliated with many teaching hospitals, hospitals that are accredited, recognized, and are what's called Green Book. What that means is they have residency programs themselves. They're affiliated with the state university a lot of the time. So they have residency programs themselves. To give a little bit of an idea of these core rotations, there's 6 disciplines in them: internal medicine, general surgery, pediatrics, psychiatry, family medicine, and obstetrics gynecology. This is the same way it is standard core rotations for all medical schools in the US, in Canada, in the Caribbean, wherever it is. These are the standard ones. So they must be conducted in teaching hospitals. Certain states, students get to choose what state they want to be in. Just to give you a list, right now our clinical department has affiliations with, say, Michigan, Chicago, Detroit, Atlanta, Washington. These are just to name a few. And every month, every few months, there are new hospitals being added and new states being added as well. When it comes to the electives, after these cores are finished, electives are fun. Electives are what students are very passionate about. For example, if you're very passionate about, say, pediatric surgery or any other thing, then electives can be done in many other disciplines. They're a little bit more comfortable. We have had students, of course, come to Canada for electives, Canadian students. We have had students go to the UK. We do have an office in the UK. So that's a little bit of fun there, just to, experience a different culture. If, say, you're going to do like a 4-week elective in pediatrics, it's great experience to do this in maybe, say, the UK, right? So you could just get a feel for another culture and that. So it's all the experience and all the hard work that you do that's going to make you successful in the end. We just give you the way. We give you the opportunity, we give you the guides, but the work is up to you for sure. So bottom line is this: when you graduate from All Saints University School of Medicine, Dominica, you meet all the requirements to apply to any international medical board exam. Maybe some may not know here. The important thing is this, to know that medicine is a regulated profession. What does that mean? That means that even if you were to graduate from the University of Toronto Medical School or Harvard University Medical School, you cannot just go and practice medicine the next day. That doesn't work that way. There are board exams, just like how there is for law. The law, LSAT law exam, same thing for medicine. Once you have your degree, then you have to apply to these medical boards to take their exams, meet their requirements, and apply for residency programs. So our school will guarantee that depending on what you want to do, because it's all an individual thing. And I'm happy to be here today because as the academic registrar, I'm the one that tailor plans every student's goal. So I make sure through their education that they meet the requirements of whatever they want to do in whichever country they want to practice in and settle in the future. here are just a few examples of students. We have many students at, again, there were so many, I couldn't fit them all. For the Canadians, University of Toronto is another one, McMaster University. So, McGill, there's many universities and programs that our students have started residency in. And the US, of course, being a bigger country with so many states and hospitals, I'd say majority of our students start there for residency. So you want to study medicine, what can be done? Very, very easy, the admissions process. Now, we as a school do not require MCAT, but if it's available, that would help your application, but it's not a requirement. So all you really need to do is go to our website, allsaintsuniversity.org, and you will see the application form. There's no initial fee to fill out an application form and submit it. With the application form, you can then, of course, your academic transcript, that's very important. If you are a university student, any program you've done, those. If not, you must have a high school transcript. The high school transcript, I should also let you know, the high school transcript, especially for grade 12, there are mandatory courses that are required. You can see them on our website, but I'll just say them here. You must have chemistry, physics, biology, math, and English. Those are mandatory. Letters of reference, and these letters of reference can be from your teachers. It could be from your, people that know you, if you volunteer somewhere, whatever it is, photographs and that. Once we receive your application form, within 2 days, Miss Deanna, our admissions officer, will reach out to you anyway and get the process moving and answer any questions, because we do have an interview for admissions. A lot of the time, our admissions committee will look everything over, and we will then have that, and you can discuss your questions during that interview as well once you apply. Transfer students, I'm going to skip. We do accept transfer students from other medical schools, should they want to. So that is it, and I've taken up the whole of the half hour, but just to give you an idea of the program that we have. So that is just a very short overview. We have, of course, our admissions department. I'd love to give the email. It's admissions@allsaintsuniversity.org. Very easy. And you can always call us, as I said, on our website. You can also come into the office, make an appointment. I know COVID is raging, but our offices are open now to appointments. So if we're located in Toronto, if you just give us a call, and if you'd like to come in and get more information, if you are in Toronto, we would love to help you. If you look into the chat, there's our numbers, and have also our emails there. I do believe there's 5 minutes left. If anybody here present at this time, because I know this is going to be recorded and you can rewatch it later on this in this fair setting. So if anybody would like to ask any questions at this particular time, we do have the 5 minutes. Deanna, is there anything that you would like to add? Is there anything that I have skipped possibly?
I don't think so. I think you've covered everything, and actually in a really quick time for once.
I know.
Too fast today.
So, yeah, half an hour, and that was that. So there we go.
I think everything was covered, though. I think it was a great job. We do also have some of our brochures back at the start of where the virtual fair is at our stand. So they will be available to download there as well, along with information about our scholarships that we offer.
Yes. Now, somebody in the chat, I just noticed when our scholarships due, when our applications due. That I should say, the way our semesters are scheduled is we have 3 points of entry a year. So it's not like every September there's a program. No, we have admissions in September, in January, and in May. So whenever, because the semester is 4 months long, at the end of each semester, we do new intake of students, depending on, which program it is. So 3 times a year, there is entry into the program, which means that you can apply at any time. Like right now, we're September 23rd. Our September semester started earlier this month. Now the admissions we're doing is for the January semester coming up. And then after that, it'll be the May semester. So there is no particular time to apply per se. It depends on really like when you want to start your academic thing there. All right. Okay, well, I think our time is up. Again, thank you so much for attending this in the live format way. But again, this recording is going to be available later on as well. All right, everybody, take care. And as I said, be safe.
Take care.
Bye-bye.